Niĩ njĩtagwo Peter Kariuki wa Mara, na gũkũ tũrĩ gwĩtagwo Gĩcungo. Rĩu niĩ ndindaga haha ndĩroreire ngũkũ ici, akorwo itirĩ na maĩ ngacihe, o ũguo tu, nake mũtumia nĩwe ũtũcaragĩria gĩa kũrĩa. Ndarutaga wĩra wa feet and turner, na ndahotaga kuona wega ngĩthima. No kuma maitho marehe thĩna, rĩu wĩra ũcio ũkĩrema tondũ mũndũ nĩendaga gũthondeka kĩndũ accurate. Nĩ ndindaga na thĩna mũno tondũ onakorwo nĩ kĩndũ-rĩ, ndingĩhota gũkĩona wega. Ũguo ndirĩ wĩra atĩ mwega ingĩruta.
Marĩtwa makwa nĩ Amina Wanjikũ wa Ndung'u, ndĩna ciana 4, ndĩna Harrison, Elvis, Edwin na Jason. Itũra rĩrĩ tũikaraga nĩ Kairia. Harrison na Elvis nĩ marĩ thĩna wa maitho, na ndanotire thĩna ũcio rĩrĩa mambĩrĩirie gũthoma. Ndambĩte kũnoti mũciĩ, ndamũhe ibuku, okorwo nĩ ibuku ndamũhe athome, ndahotaga gũthoma ibuku rĩ harĩa metha-inĩ. Oya ibuku agakuhĩrĩria haha maitho-inĩ. Tondũ maheo okorwo nĩ homework harĩa blackboard-inĩ, matiahotaga kwandĩka. Mambindagwo mathiĩ harĩa mbere, makuhĩrĩrie marũgame hau andĩke akĩkobagia. Thutha ũcio nĩ guokire ndagĩtarĩ cukuru na makĩmathima. Na mamathima nĩ makuire marĩtwa mao na makĩhe ihinda njeterere, ngĩrwo njeterere nĩ megũka.
The main goal for the Vision Impact Project is to reduce the prevalence of visual impairment and avoidable blindness in Kiambu County.
In 2019, we conducted a baseline survey around aspects of eye health, which gave us a lot of data in terms of gaps that we wanted to respond to. So in 2020, we brought together a team who worked together to develop a strategic plan for the Ministry of Health, which runs from 2020 to 2025. We approached 10 counties and we conducted the baseline data survey, where we realized that there are so many gaps in terms of the health systems in eye care.
For us, we really value this program because number one, it resonates with what our mission, our statement is to offer Christ-centered health services with the love of Jesus Christ.
The Vision Impact Project is designed in a very unique model where it aims to strengthen infrastructure through capacity building, that is training, and ensuring that we equip or improve the existing infrastructure at the county level. The second is to ensure that we integrate policies, and the third is to create awareness and advocacy about eye health.
As a county, we follow the 7 pillars of health, and one of the pillars that we value most is public-private partnership. I can say as a county, we are partnered well in the project being implemented by Kikuyu Eye Hospital right from the time we started. And we have really seen our eye services greatly improved, especially the screening going on at the community level in schools.
We adopted a style where we used to go to their places of work, and markets or such areas. And also maybe when we have big functions, the team would come to the vision to the same, and then they would do screening and treatment. At the same time, when we do at the household level, we do for 4 or 3 days, and then they go for the outreach. But we have adopted a system where we are also doing it in screening and treatment at the same time.
Ndacereirwo nĩ airĩtu a thibitarĩ, magĩũka ngĩkĩmahe thĩna wakwa wa maitho, makĩndũma harĩa Ndũnyũ, nĩho ndathimĩirwo maitho, ngĩnjĩra maitho makwa mekwenda gũthĩnjwo.
Currently, there was a lot of heavy reliance on the Snellen chart, which is just a paper that is normally used for screening of patients. And for mass screening, we could not avoid bringing in some technology. So again, we embrace the use of PIC technology, which is a smartphone-based application. Nowadays, we are able to see real-time data on a dashboard, which we never used to have. Because initially you have to go back to the files and flip through before you can actually see exactly how you're progressing. But right now, at a click of a button from the office, you can see what the people in the field are actually doing, and that's really amazing.
We've seen a very good collaboration in terms of working and the support to the county. We cannot be grateful enough, especially for upgrading our theaters like Thika Level 5, Kiambu, Igegania, Ruiru, most of them have been equipped and the personnel has been trained to conduct highly specialized eye services.
Ciana rĩrĩa ndathire nacio Gĩkũyũ, ndirĩ kĩndũ ndarĩhĩrio onakĩ. Nĩ ndakenire na ngĩgoca Ngai na ngĩmwĩra nĩ thengiũ, tondũ nĩ ndarĩ mũtukanĩre ngarigwo gwĩka atĩa na ciana ici, tondũ nacio cukuru nĩ ndaiguaga ndĩna stress tondũ gũtirĩ kĩndũ mareka, tondũ matirona onakĩ.
We've been able to reach so far a number of 180 schools in Kiambu County. We conduct same-day screening and same-day treatment. We go with our doctors to a school setup, again bringing the hospital setup in school so that any learner who is identified to have a problem, intervention is given to them on site after screening immediately, and they are able to continue with their classes.
I came to know the two boys, that's Harrison and Elvis, when they were brought in the ECD. The teacher called me in the class because they had a lot of challenge when reading from the chalkboard. It was a big bother to them.
Nilikuwa nashinda macho, nilikuwa nachukua bloka, enda hapo mbele ili nione vizuri.
They can read when they are comfortable, because when they were not having the specs, they were drawing their head down to the book.
Eye diseases are manageable. Actually, blindness is preventable if you discover the ailments early enough.
So far, through the project in the county, we have been able to screen more than 500,000 people. Of course, our target is more than 1.2 million. And out of the screened people, around 32% have been identified and diagnosed with eye issues. That has gone a long way in improving our eye services in the county, especially the aspect of all those people who are in the community, they don't know they have a problem.
Today we are holding a surgical camp which is free, and today we were aiming to have at least 100 eyes operated on cataract, and so far so good. Our cataract surgeries today are going to restore sight immediately. We anticipate that the outcome is going to be good. We also anticipate that immediately the patient will be able to see.
As far as surgery is concerned, today we managed to do 60 cataract patients between 3 surgeons. So it is very much something that can be dealt with, and we are grateful to the Vision Impact Project and CBM for collaborating with PCA Kikuyu Hospital and the county government of Kiambu to enable us by equipping us with the correct equipment.
The achievements and the milestones we've made so far have been made possible through teamwork, right from the PCA Kikuyu team, the county, and CBM.
So as Kiambu County, we plan on sustaining the program. When the programs come to an end, we hope there can be an extension after this, because the demand for eye services, Kiambu is highly populated with close to 2.9 million people. TWG is a very important aspect of leadership and governance for every project. It's composed by people from the directors and at the HMT level, and also the team from Kikuyu Hospital. The technical working group has been pivotal in guiding the project. Wherever there have been challenges, I know there are some delays maybe in the screening community or training some people. So they are the one who sit down and see what are the gaps that are going on. They are the ones also involved in the regular reviews of the project. So it has been crucial as a steering committee for this project to ensure its success. We don't want to fragment health, but if you look at how our programs are handled, we have a TWG for NCDs, for cancer, for HIV, for TB, and I also believe just to maintain the momentum and sustainability, even when the project is over, we still need that crucial team.
We thank this group of CBM
And the staff from Kikuyu Hospital, they have done a wonderful job.
Korakwa rĩkwa wega, ũndũ ũrĩa ingĩka kuma ngoro-inĩ yakwa nĩ gũcokeria CBM ngatho na Kikuyu Hospital nĩ ũndũ wa kũnjĩka ũguo maranjĩkire hau marahatũrire.
You could read for us this sentence.
Factors that promote peace in Kenya.
As soon as the cataract surgery is done and the iPad is removed, the look of joy on their faces.
Na rĩu nyonaga wega biũ, ona no nyone ũmũthĩ na rũciũ. Globally, an estimated 1.1 billion people live with vision loss due to inadequate access to eye care services.
And as the County Eye Health Coordinator, this was of great joy to me because today we saw so many people regain their sight, and we hope to do the same tomorrow and maybe the day after.
Ngai wa moyo arathime yothe mathondekire mũbango ũyũ na matũrie.
Hii naona kama mtoto mchanga.
Kũrĩa guothe Ngai arutĩte indo cia gũtũtungata na andũ acio mahetwo hinya ũcio Ngai amatungate na meke wega.
Na nĩ ndona ta ndĩthomaga kĩrĩkanĩro na ndirathomaga. Ndĩraguũragia ũguo ngona tũtemwa twĩiganĩrĩire.
I would like to appreciate Kiambu County Government, CBM, PCA Kikuyu Hospital.